New at 9, most of us either deal with sleep apnea or we know someone who does. It's when you stop breathing at times while you sleep.
The most common treatment for obstructive sleep apnea is wearing a bulky, uncomfortable face mask at night. But there's a relatively new sleep implant surgery that can replace the need for that mask.
Fox 23's Julia Gorman talked with a Tulsa surgeon who performs this procedure, and she talked to a Bixby family who dealt with decades of sleepless nights until their daughter had this procedure.
I hope to be a parent someday, and I remember the many nights my parents spent in and out of bed getting my little brother to fall back asleep. Then we'd all be so tired the next day. For my brother, that only lasted until he was about 6 or 7 years old. Taylor Parks, on the other hand, is 20, but her family only started getting a good night's sleep a couple of years ago. It's all thanks to an implant about the size of an Oreo. You like Freddie the best?
Yes.
Why?
Because he's cute.
Because he's cute. Yes, girl. Taylor Parks is a goofy, bubbly young adult. She loves hanging out with her brothers, acting in plays, and watching iCarly. It's so catchy. Taylor also has Down syndrome. When she was about 6 years old, she was diagnosed with obstructive sleep apnea. That's common for people with Down syndrome. Obstructive sleep apnea is when certain parts of your body, like your nasal cavity, palate, or tongue, get in the way of being able to take a breath when you're asleep. What Taylor's wearing in these photos is the traditional treatment for this condition. It's a continuous positive airway pressure, or CPAP mask, you wear while you sleep.
We tried every single sleep mask.
Taylor's mom, Erin, tells me it was tough enough to get her young daughter to keep this big, bulky mask on at all. But also,
kids with Down syndrome, their bridge at their nose is a lot smaller, and it's just kind of a little bit flatter. So the bridge is different. So the mask doesn't sit on the way that it should.
Erin jokes she could have opened up her own store with all the different types of masks they tried.
We were like, what, a night's sleep? What is that, right?
She says because of Taylor's lack of sleep, she would act out or fall asleep during the day. Her nighttime sleep patterns were so messed up, Taylor even started sleepwalking.
And one time I was sitting outside on the porch and the door was open, there was a storm. She walked out past me and she literally just laid in the driveway. And she was she had no idea what was going on.
Erin had to use a baby monitor well past Taylor's first few years. So neither one was getting a good night's rest.
And I could hear that voice. I mean, it's truly like a stop. And then, yeah, it's very scary as a parent.
She says Taylor didn't sleep through the night until she was around 12. Still, it wasn't consistent. Eventually, in her early teens, her mom decided to take a break from the masks altogether.
We're just going to let her get what kind of sleep she can.
But she knew that wasn't a long-term fix.
When you have sleep apnea and you're not treating it, it puts a lot of problems with your organs.
Then, at a Down syndrome conference in 2019, Erin heard about a surgery to treat obstructive sleep apnea that replaces the need for the CPAP mask. It's known as Inspire. The medical term for it is a hypoglossal nerve stimulator.
Can you show me your Facebook smile?
Erin eventually found Dr. Spencer Voth, an ear, nose, and throat doctor who specializes in sleep medicine in Tulsa. He first performed the surgery about 10 years ago and now does it at the St. Francis Outpatient Surgery Center. So far, he's done this surgery about 70 times.
It's the only device out there that treats obstructive sleep apnea surgically, only FDA-approved device.
I talked to a representative with Inspire, and he told me when the FDA first approved it, it was for patients 22 and older. In 2020, the FDA bumped down the age to 18. He says Taylor was the first 18-year-old to have it done in Oklahoma. She was also the first person with Down syndrome in our state to ever undergo the procedure. When Dr. Voth performed Taylor's surgery in June of 2020, he says it required 3 incisions. You can still see her scars. He says he implanted a battery that looks like this inside her chest. It's expected to last at least 11 years before it needs replacement. Now, he says the procedure has been improved to just 2 incisions with the same battery life expectancy.
So there is a sensor in the rib cage along with the battery. So this is the battery that's implanted into the chest wall. And so when When the sensor senses you breathing in, it tells this battery to create a stimulation, which goes to another wire that's around your hypoglossal nerve. And so every time a patient inspires or breathes, it's pushing the tongue forward and the palate forward, removing the obstruction.
Dr. Voth says if a CPAP mask isn't working, like in Taylor's case, this is the best solution right now for obstructive sleep apnea patients. He says other options for some people include using wires or sutures to change someone's anatomy or having your tonsils removed. It's important to know not everyone with sleep apnea can have this surgery. Dr. Voth says you have to fail at using a CPAP mask, you need a certain body mass index, or BMI, and you have to complete a sleep study and sleep endoscopy. This also only treats obstructive sleep apnea, not central sleep apnea. I asked Taylor's mom if she sees any downsides to the procedure. She says because of the battery, Taylor can't have a chest MRI. She's needed one since having the surgery, so they've had to work around that.
So you just hold it to you like that? Yes. And it turns on?
Now, using Inspire is part of Taylor's bedtime routine. It's as easy as turning on your TV. Taylor uses this remote to activate her stimulator, and she's good to go for the night. Then she just turns it off in the morning.
I cannot tell you, can't even explain it whenever all of a sudden it would be like we wake up in the morning and I was like, she didn't wake up.
Patients are generally very happy, but spouses and partners are usually ecstatic as well. Getting a good night's sleep is life-changing.
Careful, don't drop.
Aaron says getting up in the mornings is easier now. Taylor's sleep-related behavioral problems are gone, and there's no longer any risk of organ damage.
I have that assurance that she is getting quality sleep and that she's able to, you know, all of the functions of all the organs and things that sleep affects, that she is getting the sleep that she needs.
Aaron told me Taylor went through about 5 days of tough recovery time post-surgery. She says the hardest part was trying to keep Taylor still while the incision in her neck healed. Dr. Voth told me the improved 2-incision surgery is now less painful with a quicker recovery. That Inspire representative I talked with says this procedure is covered by most insurances and Medicare, and almost 25,000 people have had the surgery. Covering news that matters, I'm Julia Gorman, Fox 23 News.
New at 9, Governor Kevin Stitt, after initially granting parole to a former Tulsa police officer who shot and killed a woman with a crossbow back in